everybody. So honored to be here today. As he said, I'm Dr. Heather Florescue. Why am I here today? I am here because as a third-year med student 20 years ago, I heard for the first time the sound that a pregnant person makes when they realize that their baby has died inside of them. This horrible, grief-stricken wail that you can hear from 20 feet away. And it got into my soul and my heart and my skin and my teeth, and it's never, ever left. I'm also here because when we told that news to the patient and asked them, when did you last feel your baby move? They almost seemed surprised by the question and said, I don't know, maybe 2 days, maybe 3 days, maybe 4. In fact, they presented for things other than fetal movement concerns, like a headache or their water broke or they thought they were in labor. Why is that happening? Because we're afraid to educate our patients about fetal movement because we think that we're going to cause them undue anxiety and stress because, you know, stillbirth is so rare, right? But to show you there's no truth to this argument, I need you all to participate with me. Raise your hands if while you're pregnant you were told to avoid cold cuts or heat them up, wash fruits and vegetables very carefully, and to avoid unpasteurized milks and cheeses to help reduce the risk of getting listeriosis. Raise your hands. Raise your hands if while you were pregnant, you were told to not change the litter boxes for your cats to help avoid toxoplasmosis. Now raise your hands if you were told while you're pregnant that you should call if you're worried about your baby's movements because your baby may be at risk for stillbirth. I don't know if all of you can see this, but nobody out there is raising their hands. And I said the reason why we don't talk about this is fear. Fear of causing anxiety. But each year, 1,000 babies die of stillbirth compared to listeriosis, and 70 times as many due to toxoplasmosis. So we're scaring about the cold cuts and the cats. So we need to talk about this. The other reason we're not talking about this is the fatalistic idea that we cannot prevent stillbirth, so why should we talk about it? But the American College of Obstetricians and Gynecologists printed an article 4 years ago that showed that up to 47% of stillbirths can be prevented and 25% of preterm. And we are doing nothing from the American College of Obstetricians and Gynecologists all the way down to do this. The time is now. We've been using in my practice the UK protocol for 3 years, and it's done nothing but improve care. All of my patients are educated. We talk about the myths, and we make sure they call us when they're worried. And when we do, we bring them in, we evaluate, and most importantly, we ask them, are you reassured? Now, 99% will be, but those that aren't, they have 23 times the risk of stillbirth compared to others, and we try to deliver them. But I can't deliver them between 37 weeks and 38 weeks and 6 days because their concern is not as important as 2 blood pressures, 140 and or 90 or higher, 4 hours apart. The time is now. We need to listen to our patients and allow that concern that their baby is going to die inside them to matter more than just 1 or 2 elevated blood pressures. And that is why I'm here today.